Hi, everyone. My name is Mick Del Rosario, and I'm the Program Manager for San Francisco Hep B Free Bay Area. Thank you so much for stopping by our virtual booth, and I hope you're enjoying the virtual parade and festival so far. We at SF Hep B Free are dedicated towards educating and testing the community for hepatitis B, all working towards the fight against Hep B and liver cancer. And to learn more about how you can protect yourself from hepatitis B, I am passing it off to our executive director, Richard So, who will give a brief 10-minute rundown about the work we do. Richard?
Hi, everybody. My name is Richard So, and I'm the Executive Director of SF Hep B Free. Each year, we get the opportunity and we're delighted to partner with the Pistahan Parade and the Pistahan Festival taking place right here in San Francisco. Thank you so much for joining us at our virtual booth. Today, we want to talk about hepatitis B and why it matters to you. Did you know that 1 in 12 Asian American and Pacific Islander immigrant adults are chronically infected with hepatitis B? And in fact, 2 out of 3 of them don't even know they have it. And they don't know because they don't have symptoms. Unlike other diseases, most people who have hepatitis B won't feel sick until that hepatitis B causes significant deadly liver disease or liver cancer. For hepatitis B, 1 in 4 people who have it will go on to develop that deadly liver cancer or liver disease. And so thus, hepatitis B is known as a silent killer because people don't have those symptoms until it's too late. By the time you feel pain in your stomach or in your liver, it's usually late stage liver cancer, and most people don't live for longer than a year once they have the cancer. But we can change all this. There is a safe and effective vaccine that protects you for your whole life, and an affordable, simple treatment where if you go on treatment and management when it is just hepatitis B and hasn't become liver cancer, most people live full, healthy, fun, and safe lives. So who are we? SF Hep B Free began in 2007 in an effort to address the dire lack of information with both physicians and in the community about hepatitis B and the liver cancer it causes. Since then, for more than 10 years, we've been working in communities with nonprofits, with the government, with public and private healthcare, as well as community groups on the ground to raise awareness about hepatitis B, improve and do more prevention and screening, and give people who have hepatitis B or are curious about it the resources and the connections they need to get to get screened or the treatment they need. So what is hepatitis B? Well, hepatitis B is caused by the hepatitis B virus, and it is a contagious liver disease. And the disease comes in 2 forms. The first is acute hepatitis B, which means a short-term mild illness that lasts a few weeks to a few months, and then your body clears it. Some of those cases that are acute become chronic hepatitis B, which is the much more serious illness and is lifelong. It is not curable, and this version of the disease is the one that causes terrible liver damage and liver cancer that often kills patients with few to little to no symptoms at first. And the difference between these two depends largely on age. At birth and as a young person, the chances of an acute case turning into a chronic case is much, much larger. In fact, as at birth, the chances of an acute infection becoming chronic is close to 90 to 95%. And as an infant, that number drops to around 50 to 60%. And then as an adult, your chances of getting an acute infection that turns into a chronic one is much, much lower, around 5% or less. As a result of this, you can see that the most common way that chronic hepatitis B is contracted is at birth from mother to child transmission, when the mother has hepatitis B and often doesn't know it and transmits this virus to the child. And obviously, the child does not know this either. And so the child continues to grow up without realizing that they have this infection in them. And that is why many, many people do not realize that they have this infection, especially because most people with chronic hepatitis B don't have any symptoms related to the disease. Similarly, this chronic form of the disease can develop in their infancy, as I said before, the 50 to 60%, when someone in the home, like a mother or father, exposes the infant unintentionally to blood, such as through razors or cuts and bruises or toothbrushes. Again, those methods are a little less common, but that transmission does occur. It's important to note that hepatitis B is not transmitted through saliva, sweat, urine, or tears. So sharing food or sharing a bathroom will not cause someone to transmit the hepatitis B virus. As an adult, transmission of acute hepatitis B often occurs through sex or IV drug use. But again, because your immune system is developed by the time you're an adult, those infections do not convert to the chronic form and remain acute. There is no cure for acute hepatitis or chronic hepatitis, but the acute version is self-resolving, meaning that your body will fight off the infection and build a natural immunity. This is not the case with chronic hepatitis B, where you will remain infected for your whole life. So why should we care about hepatitis B now and here in the Bay Area? As you can see, there are more than 2 million Asian Pacific Islander residents in the 4 counties circled: San Francisco, Alameda, San Mateo, and Santa Clara. It's about 40% of residents, almost half. And a recent study estimated that 81,000 people are probably chronically infected, with most of those people not knowing that they have hepatitis B. In addition, we have many culturally diverse marriages and interracial couples, and so acute hepatitis B can be spread that way too. And here in the Bay, we are blessed to have such diverse cities. And in fact, we have some of the largest cities with the largest majorities of Asian populations, such as Daly City, which includes very, very large Filipino populations. In fact, I believe Daly City has the largest concentration of Filipinos outside the Philippines in one city. So now that you've heard all this, who should be tested? Well, looking at this picture, I want you to focus on the red, the yellow, and the blue. The red is in countries in which hepatitis B is endemic in that population at a rate of 8% or higher, meaning 8% of the people living there have this virus. In yellow, it's 2 to 7%, and in blue, it's less than 2%. The CDC recommends that any foreign-born persons from the regions in yellow or red should be tested for hepatitis B. And if you look at that picture, that's most of the world. Other than Western Europe, Australia, and parts of North America, most of these people and most immigrants in the United States should be being tested for hepatitis B, even though that's often not the case. Of course, all pregnant women should be tested because they don't want to pass that on to their baby as they're born. And now in hospitals, they test all pregnant mothers for Hep B to particularly stop the transmission of diseases like hepatitis B to the child. They also recommend that people who are traveling to the yellow or red regions be tested for hepatitis B as well, because you never know if you have to use the healthcare system or you get injured in those countries, whether their standards of protocol and safety procedures may leave you vulnerable to being infected by hepatitis B. A recent modeling study indicated that nearly 10% of Filipinos in the Philippines may have chronic hepatitis B. It is one of the remaining countries whose hepatitis B rates remain stubbornly high. And so we highly, highly recommend that anybody, especially those born in the Philippines who are now living here in the United States, get tested for hepatitis B. So what to do about it? Screening and vaccination. The great thing about hepatitis B is it's easy to take action and protect yourself and save lives. First, just get screened. All it takes is to ask your doctor for a hepatitis B test. And it's usually free because it counts as a preventative service because it can prevent the development of liver cancer. And once you get screened, if you are not infected, we recommend you get vaccinated. The vaccination will protect you for life and is easy. Now there is a 2-shot vaccination taken over 1 month, so that simply after about a month or two, taking these 2 shots will protect you for the rest of your life against this virus that so often causes liver cancer. Both the vaccination and screening are often free because they serve as protective services. So what happens if you do have hepatitis B? Should you be very concerned or very scared? No, the answer is no. Fortunately, if you catch your infection, your hepatitis B infection early, there's treatments for it, which usually comes in the place in the form of a daily pill that is taken once a day, and you take it for the rest of your life. For most people, when their infection is caught early, this daily pill will keep them healthy, safe, and live a full, healthy life for the rest of their lives. In addition, often if you catch an infection early, there are many people who will not even need to start on the pill and will just need to go into their doctor twice a year to check their liver numbers and their liver health and ensure that no further action needs to be taken. This pill is usually covered under Medicare and Medicaid, and often under most employer insurances. So here's where you can come in. How can you help? Well, first, protect yourself, save yourself, get tested, and seek treatment if you need it. This 15-minute call to your doctor to schedule that appointment may save your life. And then empower others. Educate your family and friends. So many of us have immigrant family members, older brothers, sisters, aunts, and uncles who are probably vulnerable to this disease and may not even know that they have hepatitis B and they could be a ticking time bomb for liver cancer. So spread the word. Tell them about this. Tell them to ask for a hepatitis B test. You can fight the stigma and the silence around this disease. We know often that cultural barriers, monetary barriers, language barriers, or just machismo that exists in Asian cultures, or the idea that you don't want to burden your family members, prevents many from seeking more care for diseases that they may have or looking more deeper into their situations and their conditions. Let's not make this happen. By fighting the stigma, we can talk about this disease and save more lives. Finally, you can become a Hep B free champion. We are always looking for community members to work with us and help us reach more members of the community. In fact, we've done that a lot here in San Francisco through a lot of Filipino churches and Filipino grassroots organizations. Of course, you can also donate to us at sfhepbfree.wedid.it. We always appreciate any donation.
Hey, Mick here again. Thanks again for watching. Be sure to check out sfhepbfree.org to learn more about our fight against hepatitis B and liver cancer and ways to support our organization. Enjoy the rest of Pistahan and have a great day.